Welcome to Advocate Today. I'm Aaron Dean. The Biden administration is commemorating the 60th anniversary of the March on Washington, inviting civil rights leaders and their families to the White House. The president and vice president met with the family of Dr. Martin Luther King Jr., along with Reverend Al Sharpton and leaders of the Anti-Defamation League and the Urban League. This all comes after the racist shooting in Jacksonville. President Biden delivered a stark warning about the rise of extremism in the United States.
On Saturday morning, the nation has observed the 60th anniversary of the March on Washington. By the evening, a white gunman in Jacksonville, Florida, reportedly driven by racial animus, went on a shootings rampage at a store near Edward Waters University, a historical black university. 3 black Americans were murdered in cold blood. While we gather the facts and law enforcement has opened a federal civil rights investigation to treat this as this terror as a possible hate crime, the act of domestic violent extremism, it clearly is.
The president also gathered with civil rights leaders to commemorate the 60th anniversary of the founding of the Lawyers Committee for Civil Rights Under Law. The committee pursues equity and equality for all races and ethnicities under law. The Biden administration is also calling for more common sense gun legislation. Human Rights Campaign President Kelley Robinson posted a message on X saying that racism is killing us. The gunman in the Jacksonville attack was turned away from an HBCU before he killed 3 people. Robinson says politicians need to address the deadly blend of unacceptable policies.
I want to say clearly, we have to ban assault weapons. There is no reason that they exist in American life. There is no other developed nation that has a level of access to weapons that we do here, and it is killing us. It is literally killing us every day. And we have seen time and time again, from Club Q to Dollar General and so many times in between, that the violent political rhetoric mixed with easy access to assault weapons is resulting in our deadliness to our lives. Pure and simple. We have to ban assault weapons. And I also think that this is a moment where we got to really be interrogating why people are using such violent political rhetoric. We've seen 550 anti-LGBTQ plus bills across the country in the last legislative session. Even if those bills don't pass into law, they are joined by social media campaigns that have a 400% increase in violent rhetoric towards our communities. That is dangerous. Look, anybody that's looking at this, any moral person, any good person should say, it's unacceptable. It is enough, and it has to stop.
Robinson's comments come after the HRC's Equality Ball in Las Vegas, highlighting Black queer ballroom culture while offering HIV testing, voter registration, and other resources. And Yale University is settling a lawsuit with students who claim the school discriminated against them due to mental health disabilities. The students say that they were forced to withdraw if they showed symptoms of severe mental health disability. Then they were banned from visiting campus without permission. Some said that they had police escorts to collect their belongings. Under the settlement, Yale is changing its leave of absence policy. It's also agreed to allow students on medical leave to have more access to campus. There are fewer and fewer places trans people can receive gender-affirming care. That's because of newly passed state laws and confusion about what is allowed. Dr. Jennifer Anger is the only physician in San Diego providing gender-affirming care, and she says proper care for trans individuals should be the standard. Dr. Anger, thank you so much for joining us today on the show. How are you?
Good, thank you, and thanks so much for having me.
Yes, of course. So can you tell us a little bit about your role as the head of the Gender-Affirming Clinic at UCSD Health, and kind of also dive into the importance of providing quality care for the transgender community?
Well, yes, it's been great to be part of a team that had taken a lot of steps towards performing surgery, medical care, psychological care for the transgender population and non-binary population. What I came in sort of on the later side to help build what's called bottom surgery program, or gender affirming pelvic surgery, which is vaginoplasty in transgender women, creating a vagina, if you will, and then masculinizing surgery in transgender men. And that includes hysterectomy, and then a couple different masculinizing procedures that we do. And so it was really a great opportunity because UC San Diego was ready to take that next step and build a bottom surgery program right around the same time that I had some exposure to the field. And really, as I saw some of my colleagues doing these surgeries, I really thought, well, this is what I trained for. And so it's really been a great, almost 2 years now that I've been at UC San Diego Health.
How do you address the issue of limited access to specialists in this field for transgender individuals? How do you work towards that?
Well, I think it's interesting because, before 2016 with the Affordable Care Act, which basically prohibited discrimination on gender, there was very limited access because there wasn't even insurance coverage. So now we have essentially global insurance coverage for gender-affirming care, including medical care, psychiatric care, surgical care, any kind of medical care relating to transitioning. But we're still in a shortage of providers who give that care. And so there's kind of two ways to address the shortage. One are people like me who I was basically, I'm a urologist and I still perform reconstructive urology on cis people, but I transitioned, no pun intended, from urologic care to gender health. So you have people who have been providers in other fields who then can change what they're doing and get more education. And then we're starting to have training programs so that people coming right out of training can have, let's say, another year of gender health training, for example.
Well, Dr. Anger, could you kind of explain why proper medical care for transgender patients is so vital, and kind of what are some of the consequences if that proper care is not provided?
So I think focusing on access to care, patients who get affirming care do better. I mean, we've done some studies looking in the literature on getting medication, getting surgical treatment, and their quality of life goes up. Their body image goes up. And we know that untreated, not that it's an illness to treat, but when you have gender dysphoria and patients are not allowed, or people are not allowed to be affirmed, they do poorly. And we see higher suicide attempt rates in patients who don't have access to care. And then when they finally get that care, it can be very discouraging for a patient to, go to get their surgery and then again called the wrong pronouns or not treated with respect. And that makes kind of, even if let's say they have a good surgery, it puts a gray cloud on the whole experience. So it's so important for patients to be able to go to the doctor and be treated like they should be treated.
Because like you said, it's more than just, like you said, having a successful surgery. It's about treating the person with care and respect throughout the entire process.
Exactly. Absolutely.
Thanks so much for watching Advocate Today. Download the app in the Apple or Google Play Store to stream us live, and you can even subscribe to our YouTube channel. For Advocate Today, I'm Aaron Dean.